Hey, it's Chuck. If you watched the last two episodes and thought about being old, getting old, and you want something to do about it, then this one's for you. Let's dive into it. Over the past 2 days, I talked about the ageism that we absorb before we get old and the loneliness that characterizes being old in America right now. Today, I want to talk about what it actually looks like to build a world where aging is something that you can do with dignity and what we collectively owe each other to make that possible. The United States does not have a coherent system for supporting older adults. What it has is a patchwork. Medicare for acute medical care, Medicaid for nursing home care for people who've spent down their assets, Social Security for income, and an enormous, largely invisible infrastructure of unpaid family caregiving holding everything else together. Only 3% of adults over 50 have long-term care insurance, and 20 to 47% of applicants are rejected depending on their age. That gap between what older adults need and what exists to support them is filled almost entirely by family members, mostly women, mostly working, mostly doing it without training, without pay, and without adequate support of their own. Dr. Richard Frank, Senior Fellow and Director of the Center on Health Policy at the Brookings Institution, and Margaret T. Morris, Professor of Health Economics Emeritus at Harvard University, Dr. Sherry Glied, Professor at the NYU Robert F. Wagner Graduate School of Public Service, and Dr. Jonathan Gruber, Ford Professor of Economics at MIT, published a March 2026 Brookings Institution paper arguing that the U.S. long-term care system is failing older adults, not incidentally but structurally. The home and community-based services that most older adults prefer and the same care that research shows produce better health outcomes than institutional care are not entitlements under Medicaid. People who qualify are frequently on waiting lists. The cost of home care is out of reach for most middle-income households, and the system that's supposed to help is structured in a way that requires people to literally become poor before it fully activates. The really shitty part of this is that it works exactly the way the system was designed to work, and it has consequences for how we think about what we owe each other as a society. Most of us will or already do have an older person in our life who needs something. Maybe not a nursing home necessarily, but just help, even if it's help with the loneliness that yesterday's episode documented in 33% of adults, or help feeling like they simply matter to somebody who isn't paid to make them feel that way. The research on what actually helps is consistent, regular contact, genuine presence, being treated as a person with a history and a perspective rather than as a problem to be managed. I'm Chuck, the bald therapist. Work on you. Take no bullshit from your own reticence to engage with someone who just needs to know that you care enough to pick up the phone. Remember that you matter, and have a gentle rest of your day.